All right, welcome to the deep dive.
Great to be diving in.
Today, we're wading into some pretty heavy but incredibly important territory. We've got a stack of material here, reports, research, news, legal analysis, all focused on unaccompanied and immigrant children in the U.S.
That's right. And specifically, we're looking at their health and well-being, how immigration policies really impact them, on the ground.
Yeah, and also some of these temporary relief options that pop up in the sources like humanitarian parole or medical deferred action.
Exactly. Our goal today is really just to pull apart the threads on this complex topic, understand the core challenges these kids face trying to get the care they need.
See how policy decisions shape those realities, and look at what the sources suggest might help move things forward.
Think of it as a way to quickly get informed, cutting through some of the noise to get straight to the crucial insights in these different reports and articles.
So let's maybe set the scene first. The sources highlight a really significant trend.
Yeah.
The sheer number of children arriving in the U.S. without a parent or legal guardian has it's ballooned over the last decade.
It really has. It's quite dramatic. The Migration Policy Institute and American Academy of Pediatrics report specifically notes it hit a record high in 2022.
Wow.
And these children, they initially enter temporary U.S. government care that's overseen by the Office of Refugee Resettlement, or ORR.
Right, ORR. And the stated aim, usually, is to place them with approved sponsors out in communities while their immigration processes are happening in the background.
Exactly. But this is where the sources really zero in on a major challenge. That transition, moving from federal custody into community life.
Okay.
The material we looked at shows this transition is just riddled with hurdles, particularly for accessing essential medical and mental health services.
Okay, so let's dig into that. Once a child is released from ORR care, placed with a sponsor, what are these main roadblocks they hit when trying to get health care?
Well, the MPIAP report sort of breaks it down into three main buckets, you could say.
Okay.
First, there are barriers related to the ORR system itself. Second, issues just inherent in the U.S. healthcare infrastructure. And third, unique hurdles tied to the individual child and their sponsors' immigration situation and circumstances.
Let's start with the ORR side then. What are the kind of pain points there according to these sources?
Yeah, so the sources raise concerns about some really basic things like the health paperwork provided when the child is discharged.
Okay.
Often it's just insufficient, or maybe it doesn't even get to the community provider who needs it. There's frequently a lack of direct communication between the clinicians who saw the child in OR custody and the new doctors or therapists in the community.
So a handoff problem.
A big handoff problem. Plus, things like kids being discharged with only a very limited supply of medication for chronic conditions.
Oh, that's tough.
Yeah, and consistent post-release case management, the kind that could really help navigate these health needs, is often inadequate or sometimes just completely non-existent.
So basic continuity of care is a huge issue right from the start. What about the U.S. healthcare system itself? You mentioned that.
Right. Here, a really fundamental barrier is, unsurprisingly, cost.
Money.
Simply put, healthcare is expensive, and these families, these sponsors, often just can't afford it, especially if they don't have insurance.
And insurance is tricky because while children do have insurance while they're in OR care,
Correct.
that coverage typically ends the moment they are released.
Exactly. It just stops.
Yeah.
And getting new insurance, like public options, say Medicaid or CHIP, well, that's where it gets really complicated.
How so? Is it just not available to them?
It's very complex. The sources explain many children released simply don't qualify for these programs right away because of their immigration status.
Oh.
Now, even in states that do have options to cover children regardless of or based on certain pending statuses, and that's a real patchwork, it varies state by state.
Right, not everywhere.
Not everywhere. And even where it is an option, accessing it isn't immediate. There can be waiting periods, really complex application processes.
Bureaucracy.
Lots of it. And unfortunately, often just a lack of awareness that the eligibility even exists, or sometimes fear of using it.
Okay, you mentioned fear and individual circumstances earlier. Does that tie into why families might not even try to get benefits they might be eligible for?
Absolutely. This is a critical point the sources really emphasize. There's this deep-seated fear, often stemming from things like the public charge rule.
Ah, yes.
That access of any public service, even, say, health benefits for a child, could somehow jeopardize their or their sponsor's immigration case down the line.
Wait, but I thought the public charge rule specifically excludes things like children's Medicaid or CHIP.
Yes, that's the crucial misunderstanding the sources point out. It's a huge one. These specific child health benefits are explicitly excluded from public charge calculations. Accessing them for a child should not negatively impact an immigration case.
But the fear is real.
The fear is very real. And that lack of clear information means this misunderstanding becomes a very tangible barrier, stopping vulnerable kids from getting care they need and are often entitled to.
Wow. So it's not just the policy itself, but the perception or maybe the misunderstanding of the policy creating a barrier.
Precisely. And beyond all that, just finding a provider is tough too.
Right.
The sources point to widespread clinician shortages, especially for mental health, dental care, and specialty care. Trying to find someone accepting new patients who speaks the right language, understands cultural nuances, and is trauma-informed.
That's a tall order.
It's incredibly difficult, especially in rural areas or for specific needs. So many layers. Lack of paperwork, losing insurance, confusing rules, the fear factor, and just not enough doctors or therapists available.
And you have to layer those systemic barriers onto the experiences many of these children have already been through.
That's right. The sources make it really clear that even if they arrive physically healthy, many unaccompanied children have experienced significant trauma.
Yeah, the Tow Youth Justice Institute report really digs into this, doesn't it? Specifically looking at the devastating impacts of punitive immigration policies like family separation and child detention.
It does. It talks about mental health and development, and this is where it gets deeply concerning. The report talks about the impact on a child's developing brain.
How so?
It explains that separating children from parents, it directly attacks that critical attachment bond, which is absolutely fundamental for healthy brain development, for a child's basic sense of security. The report describes how kids' responses can range from, outward protest and despair to this kind of profound detachment.
And that detachment, the sources suggest that can damage relationships for life.
It can leave lasting scars on their ability to form secure bonds later on. What's more, the chronic stress from living in situations without safety or under constant perceived threat isn't just psychological. It can become toxic.
Toxic stress.
Yeah. And the report uses a really powerful phrase, architectural organ damage.
Architectural organ damage. Can you unpack that based on the source?
It essentially means that prolonged toxic stress literally affects the physical structure and the development of organs and biological systems in the body.
Wow.
This isn't just abstract. The report links this directly to lifelong health issues, like an increased risk of chronic diseases, heart problems, diabetes, and even reduced life expectancy. The body really does keep the score of that trauma.
That's a profound takeaway from the research. The report also sounds a pretty strong alarm about detaining children for immigration purposes.
It does. The source notes that while, yes, detention is practiced in many countries, it's widely condemned by medical groups and child rights organizations across the globe.
And is it effective?
Critically, the report states there is no research supporting child detention as being beneficial to children, or even effective as an immigration control strategy.
So these experiences, the trauma from home or the journey, maybe detention, this separation, they create this unique and complex set of health needs.
Exactly. Needs that require a very specific kind of care, one that's, as the MPIAP report emphasizes, trauma-informed and culturally sensitive.
Okay, so given these really significant challenges and needs, the sources also look at some temporary legal pathways that exist, lifelines sometimes.
Yeah, though it's important to stress the temporary part. These aren't permanent solutions, right? More like temporary discretionary measures.
Got it. What's one example?
One is humanitarian parole. It's under the Immigration and Nationality Act. This allows the Secretary of Homeland Security to temporarily let individuals into the U.S. for urgent humanitarian reasons or if it's seen as a significant public benefit.
And that gives them temporary lawful presence.
Yeah.
Protection from deportation.
Yes, and in some cases, permission to work. But, and the sources are very clear on this, it's entirely discretionary. It's not meant to be a substitute for normal immigration procedures. And on its own, it absolutely does not grant permanent status or provide a path to citizenship. It's been used, as the sources mention, for various specific groups facing crises, like people arriving from Afghanistan or Ukraine recently.
Okay. And the other temporary option mentioned is medical deferred action, sometimes called general or non-military deferred action.
That's another discretionary tool, typically used by USCIS, the immigration agency. It's basically a decision by the government not to pursue removal or deportation against someone for a period of time.
And who might get that?
It's often considered for, say, undocumented parents or caretakers whose presence here is deemed essential for a child in the U.S. who has a really severe medical condition, a disability, or other special needs.
So again, temporary protection, not status.
Exactly. Temporary protection from deportation, and it might allow work authorization, but just like parole, it doesn't provide actual immigration status or a direct pathway to a green card.
The NBC News source you mentioned highlights a specific case that really drives home how, well, precarious this can be.
Yeah. The case of SGV, a 4-year-old girl with a life-threatening illness, short bowel syndrome, and her mother.
Oh.
They were granted humanitarian parole for 1 year, but only after a lot of public advocacy, a public plea.
And that was after their previous parole had been unexpectedly terminated.
Exactly, which just shows how quickly these temporary protections can be withdrawn. This specific case, as the source covers it, is a powerful example of how tenuous and discretionary this relief really is, and how advocacy can become absolutely necessary just to maintain temporary safety.
And there was also that ACLU of Massachusetts source talking about a lawsuit.
Right. That adds another layer. Their lawsuit challenged the abrupt termination of the whole medical deferred action program under a previous administration. They argued it was inhumane and unlawful.
So that just further underscores that these aren't stable, guaranteed protections. They're discretionary tools, vulnerable to policy shifts, legal challenges.
Absolutely. They are, at best, temporary reprieves. They don't offer long-term security.
Okay, so given all these significant challenges we've discussed, what do the sources suggest are potential ways forward? What recommendations emerge from all this material?
Well, the recommendations generally circle back to a core idea. Ensuring these children are healthy isn't just, good for them individually. It actually benefits society more broadly.
That seems like a pretty fundamental insight guiding a lot of the proposals, doesn't it?
Mm-hmm.
What are some specifics?
A big one is strengthening that continuity of care we talked about earlier between ORR and the community.
Handoff.
Exactly. Better transfer of health information, better communication between providers, and making sure there's robust post-release support, including help navigating the health system.
Makes sense.
Improving access to public health insurance is also key. The sources talk about encouraging states to maybe extend eligibility more broadly, regardless of immigration status, or at least speeding up enrollment where eligibility does exist.
And what about addressing those significant mental health needs you mentioned?
Hugely important. Increasing access to trauma-informed mental health clinicians is crucial. Same for other specialty care, like dental services, which often gets overlooked. The sources also suggest that healthcare systems themselves can and should make changes to be more welcoming and accessible.
Like what kind of changes are they suggesting?
Things like simpler scheduling systems, guaranteeing access to qualified medical interpreters, maybe offering more flexible hours, expanding telehealth services where appropriate.
Practical stuff.
Yeah, and intentionally hiring culturally representative staff, really trying to create what the sources call safe spaces where families feel comfortable actually seeking care, overcoming some of that fear we discussed.
Schools come up too, right, as potential partners?
Yes. Schools were seen as being in a potentially unique position. Their enrollment processes could be leveraged to help connect children to health services right from the start. Partnering with clinics for school-based services is another idea, though. Importantly, the sources suggest funding this through dedicated grants, not by straining existing school budgets.
That's a key distinction.
And maybe creating specific, well-designed programs for newcomer students, sometimes called newcomer schools or academies.
And looking even broader, community or government action.
Yeah, the idea of community-based multidisciplinary coalitions comes up, bringing together social workers, legal aid folks, educators, clinicians to improve referrals and coordinate services better across different systems.
A team approach.
Kind of. And at the government level, sources suggest considering dedicated roles or offices focused specifically on immigrant integration, addressing health, youth, and language access challenges, and supporting community organizations that provide training for health facilities on cultural sensitivity and language access.
And finally, there's that call to, stop the policies identified as harmful in the first place.
Yes. Advocates cited in the sources strongly urge governments to cease practices like family separation and child detention, and instead to promote post-migration policies that actively prioritize protecting children and enabling their recovery. The material really emphasizes that resilience is possible for these kids, but it requires restoring those protective relationships and ensuring a basic sense of safety and stability first.
So this deep dive into the sources really paints a comprehensive, if quite challenging picture of the obstacles unaccompanied and immigrant children face trying to access health and well-being here in the U.S.
It definitely shows how policy decisions, the complexities of the healthcare system and individual circumstances all intersect, often creating significant, sometimes really unexpected barriers.
Yeah, and it highlights how the temporary relief options that are available are discretionary, often fragile, but also how crucial advocacy and community-level efforts are in just navigating these systems and offering some measure of support.
So wrapping this up, what does this all mean for you listening?
Well, considering that really profound finding from the source material about toxic stress, causing actual architectural organ damage, and potential lifelong health problems for children exposed to chronic adversity and instability.
It really does stick with you.
It does. It raises a critical question for all of us, I think. How can our communities, our systems, ensure consistent, stable access to genuinely trauma-informed care and truly supportive environments for all children, regardless of their migration journey, to actually mitigate these incredibly severe long-term health consequences? Something to think about.